difference?
What is the difference between this picture and this picture?
I see more, the one on the top was the letter? The little point. What's that letter on the QRS? I see more QRS on the A one.
Okay. You're not catching. Check again. Let's see who catches what. There is a huge difference there.
The QRS is wider?
Okay.
No.
Oh. 1, 2, 3.
No. Wrong direction.
A.
No. It is so obvious. You don't even need to count anything. It's to see it. Okay. Let me help you out. Now you're gonna say, oh yeah. Remember one of the first chapters that I told you?
The ST is negative on A.
What was that?
The ST, the ST, isn't it like negative?
Okay, stand up and show it to me.
So on this one, both of them, the ST are both negative, but here it's not the ST. Here it's the, what would that be?
The QR.
The QR. And then it changes here, so it's two different ones here and only one there, but I don't know the name.
That is correct. Remember, pay attention to this picture. QRS. This is the ST. It's going below. This is supposed to be above. Look at here, the same. QRS below. But look at here. Here is QR. Oh, the QRS is below, but the T is up. Do you notice that? That is embedded. Look at the next one. Here is the QRS that is negative, and the T is positive. Here is the other way around. The QRS is positive, and the T is negative. But this is not a negative, just negative. Look at this, how wide they are, how wide they are, how wide they are. And these ones goes in the same model, if you will. So here it happens, we're gonna see it later on, when you see them in the same direction. When the T is negative in both, in the 6 seconds in this strip, you see both in the same, at the same level. It's the T that is negative, everything else is positive. That will be unifocal because it goes in unity. It's the same shape. Here is combined, multifocal piece, because this changes now. Some of them are positive, some of them are negatives. It's not like the T is negative, the T is negative, and everything else is positive. Here is the QRS is negative, the T is positive, the QRS is positive, the T is negative. So it's switching. So then it's a different condition that the patient has. So it's not the same that one patient has no left arm versus the patient that has no left leg. It's not the same. So this person misses a left arm, the other one misses a left leg, the other one misses the right arm, the other, and so on and so forth. So basically that's what you have to think Now, you will not be asked about this. It's just for you to notice that something is kind of off, but what is it? And what part of the heart is failing right here? What is the problem with the heart? What part of the heart is not working properly?
Ventricles?
The ventricles. Because the ventricles are the ones that causes the QRS and the T. In both of the pictures is the ventricles. Now we're going to explain why those changes. It says right here, left ventricular PVCs have an upward deflection. See? Left ventricular PVC have an upward deflection, positive deflection. Right ventricular PVC have a downward reflection. So let's go back to the picture. So this is produced by the left ventricle. See? Left ventricle, because the QRS is upward, it's positive. QRS, positive, it's left ventricle. Here, we're going to see that this is the right ventricle, but this is the left ventricle. So both ventricles are not functioning normally. So now we know, in this case, I'm just going to focus on the left ventricle and say, oh, this is just the left ventricle, because I can see that only one deflection is upside down. Everything else is up. So as soon as I see here, I said, no, this patient, I'm going to focus only on the left ventricle. Here is the entire heart. Look here, look here, look here, look there. So the patient is more compromised. Diseases are considered more significant than right ventricular PVCs. When the patient has problems with the left heart, patient tends to get worse, more complicated, tends to die faster, versus if it is the right side.
Because the body needs oxygenated blood, right?
Because the left side, the ventricle on the left side has oxygenated blood. And that blood needs to be pumped right there to the heart and to the brain to maintain the patient stable. But if it's not, the blood on the right side is dirty, no oxygen. It's not good. I cannot just go there and split the blood and, hey, have the patient working. It's like not having in the blood. Regular at some times. And we saw that. It looks nice, it's just that there is one part that is not looking like this. See? It's just that when you see all this, it looks very chaotic. So you say, uh-oh. The only thing that you know is that this is not normal. You know already because you learn how the normal looks like. If you see something like this, like this, like this, and continuous, you say, oh, probably this patient is not having much. So the only thing that you have to do is count the rate. If it is within normal, and then you know, oh no, this patient is between 60 and, oh no, no worries. This patient can wait. I can take some time to send them to the cardiologist. But if it's something serious, you have to admit the patient in the hospital immediately. So that's basically the premature ventricular complexes. If every other beat there is a PVC, it's called ventricular beginning or bigeminal. Remember, if every other beat, so one normal, one premature ventricular contraction, one normal, one premature ventricular contraction. That is called ventricular bigeminal. If every third beat is a PVC, then you call it ventricular trigeminal. So you have 1, 2, 3 QRS normal, then a PVC. Then 1, 2, 3 normal, then a PVC. Then you call it trigeminal because you have 3 good ones. This is one good, the other one not good. One good, the other one not good. Or 2 good and not good. So let's see it. See? Right here. One good, not good. One good, not good. One good, not good. That is called ventricular bigeminal. It says the first one, the third one. The first one, the second. The first one, the second one. First one, second one. 2. Because bi means 2. Remember.
And is the big one, is that 3? Is that 3 or is not 3?
Which one?
The big one? No.
No, this is the good one. This is the wrong one.
Okay.
This is the PVC. This is the normal one. This is the PVC. You see PVC because it's wider. And if it is wider and it's the ventricles, then immediately we know that something is going on with the ventricles. And if it goes too close, see? These are too close. This is supposed to be air. This gets too close to it, so it's premature. What about this? 1 good, 2 good, the third one is not. 1 good, 2 good, the third one is not. That's what it's called ventricular trigeminal. Good thing you're not gonna get this in your exam.
Then why is in the PowerPoint? Why it's in the PowerPoint?
Because it's part of the lectures. Maybe because I'm a genius. Maybe because I'm listening. What is it that I don't give you? And what if you happen to have a question like this, and the first thing that you're gonna say, oh, why wasn't my PowerPoint? Why was no? You're gonna say the teacher didn't show me this. The teacher didn't teach me this. Because we are like that, right?
Okay.
My students pass the test. If somebody doesn't pass my test, it's because they didn't read it, the questions that I told them to read, or they actually didn't do anything.
Thank you.
Okay, agonal rhythm. Anybody heard about the word agonal? Do you have any idea what is agonal?
It sounds like agony.
Yes, that's exactly what it is. And what is agony? When someone is agonizing, what is it? It's dying. It's the last breaths. That's it. It's over. That's called agonal rhythm. It says dying heart.
Agonal rhythm.
See, when the patient, have you seen the movies, right? When you are close to the loved one, whether it's a friend, whether it's a relative, and then the person starts talking to you, and then it's like they saying goodbye, and they start going like this, like taking a deep breath, and then They stay. That's it. That was an agonal reading.
She's leaving.
Why?
Yeah.
Sorry.
You're supposed to get a bicycle. Okay?
Bye, teacher.
Bye. Take care. Good night.
Good night.
It says right there, severely impaired heart is only able to cough out occasional beats for the ventricle.